Okay guys, welcome back to EncinitasFamilyCare's education series. Today we're going to be talking about cold treatment because we're about to start cold and flu season coming in this fall, and I wanted to make sure that we talk about these things. Maybe your doctors have talked to you about getting your cold or to get your flu shot. I want to recommend that if they have recommended that, please do it, because the influenza virus can be a very devastating thing to various populations. We'll touch that on a different video here today, but make sure and get those if your doctor is talking to you about it. I want to talk to you about the treatment for colds whenever you get them. The first thing to realize whenever we're talking about treating a cold is that antibiotics are not the treatment for your colds whenever you get those symptoms. How do you know whether this is a cold rather than a sinus infection or something that does deserve an antibiotic? The reason that the antibiotics don't treat your cold symptoms is because colds are caused by viruses. There are a whole different array of viruses that can cause this, but viruses are innately different from bacteria. They're about 1/100th the size of the smallest bacteria that there is, and the machinery that's inside a virus is completely different than that is in a bacteria. So if we're using medicines that are made to destroy the machinery that's in bacteria, obviously whenever you apply it to a cold, it's not going to do anything. It's like trying to get someone whose main goal is to treat European car problems, and you give them a Japanese car. They're not going to necessarily know the machinery that they see in there. So we want to make sure that we're doing this. A way that you can recognize that the symptoms that you're having are coming from a virus rather than from a bacteria is bacteria, because they're so much bigger than a virus, they actually have to literally crawl from one place to another in your body or be moved physically by your hands to get there. So if you're feeling symptoms in different parts of your body, like your nose, your throat, your lungs, your chest, odds are that this is because of a virus rather than a bacteria, so the antibiotics are not going to be that helpful. If you're getting symptoms in one eye and nothing else, that might be an eye infection. If you're getting some pain in one part of your cheek, that might be a sinus infection. But if you're feeling the pressure on both sides, much more likely to be a virus and much less likely to be helped by an antibiotic. So then what do we do if you've got a cold? Realize that every single symptom you get whenever you get a cold is not because the virus is making any kind of a poison and putting that poison in your body. The symptoms that you are getting are because the virus is making a little bit of inflammation in there, and your body is running over there to try and attack it, and it amplifies that inflammation. Inflammation is the way that your body tries to accomplish anything on a microscopic level. Send a bunch of blood to that area. If you sprain your ankle, a bunch of blood is going to go there, and your ankle is going to swell, and it's going to try and heal all of that damaged tissue. The same thing is going to happen whenever you get these viruses inside your body. Your body is going to attack it along these moist surfaces of your nose, of your throat. That's going to make you make a little bit more phlegm. That's going to make you have a tender throat whenever you try and swallow things. So the thing that you should be thinking about doing is trying to take some kind of medicine that has an anti-inflammatory property. You know how big I am on trying to treat inflammation from musculoskeletal injuries, but also in the context of these colds. So if you can get an anti-inflammatory medicine like ibuprofen, which comes in the form of Motrin or Advil, that can be a great way to treat this stuff. I'm also a big fan of naproxen, which is the same medicine as Aleve. And the way to take these is you have to take it at a high enough dose. In the case of Aleve, for most adults, that's going to be 500 milligrams or 2 Aleve, or 1 naproxen prescription tablet, and take that consistently, meaning twice a day, every day, from as early as you start to even think that you have a cold until the last symptom goes away. That's going to make it so that you don't make quite as much inflammation in your throat, you don't make quite as much inflammation in your nose and sinuses, thus you're not going to make as much phlegm, you're not going to be so congested, and hopefully this prevents you from developing sinus infections that then can come on top of those viral infections that you have. That would be a separate infection, and you would know that came on because that general feeling of congestion starts to turn into some focal pain, like a toothache that won't go away, or a knife stabbing pain right in the center of your cheek, or maybe in your forehead. But trying to treat that inflammation as early on as possible is going to be the way that you can keep this cold to the minimal symptoms and the shortest length possible. Good luck with that, and have a good fall and winter season.